Welcome to Life by a Thousand Cuts, a podcast series about skin cancer surgery. I'm your host, Associate Professor Tony Dicker, and in each episode, we'll share practical insights to support your skin cancer surgical practice. Today, we're looking at surgical marking pens and how we draw our surgical plan. So let's get into it. On quite a few occasions, I've carefully drawn out my surgical plan, wiped the area with an alcohol wipe to inject the local anesthetic, set up my surgical field and cleaned the skin, then realised that my markings have washed off. So frustrating. That, of course, made me wonder, why have we got pens that are insufficient for the task at hand? And down that rabbit hole I went. A quick PubMed search, and there's quite a few articles that are relevant to this topic, but also helped me clarify what are the actual issues to consider in this regard. So obviously, does the pen stay on the skin is a significant issue, but the reverse is also relevant. Can the pen cause tattooing or staining of the skin is worth considering. Then the infection risk, can it cause infection? Is it related to infection? Can it cause cross-contamination if we're reusing a pen? And does the pen need to be sterile for drawing on a skin surface? Now, another thing to consider, of course, is not just the pen, but also the antiseptic washes that we're using. Common things we're using are the povidone iodine, so well-known brand name of Betadine, although there are some other brands available of the same product. And then the chlorhexidine solutions, and there's a number of different products containing chlorhexidine. We shouldn't forget alcohol, of course, and 70% ethanol is used in many things, from hand gels to those small little cloth wipes or alco wipes, and a really good, effective way of killing microorganisms. But each of these agents could have different effects in smearing it and removing pen marks. That's part of the equation we need to consider about how to keep the pen intact, and also relevant to infection risk. We look at general types of surgical marking pens available. Traditional agent is gentian violet. So many years ago, this was actually painted onto the skin using a cotton tip. It's only in more recent years we've actually had pens made available containing the product. Another commonly used marker is a permanent marker, which comes in many sizes, many colors. And then, of course, some people do use a standard ink biro, the ones we use for writing on paper. So we've got to look at those three options when we're marking out surgical margins. So the first article I wanted to discuss is one from the Journal of Perioperative Practice in 2018, and it's titled "Which Pen and Comparative Study of Surgical Site Markers." So they had 5 volunteers, and they were of different Fitzpatrick skin types, so darker and lighter skin colors. And they were marked with 10 different pens. Now, these people were volunteers, not actually having a procedure done. They just wanted to examine the effect of different pens and the effect of washing of those pens. So those people each had 3 different areas marked. So each person had 30 pen markings in total. And they had 15 minutes to let the ink dry before any prep was applied to see if it washed off. So that factor is something to consider. It's a little bit different to what happens for our skin cancer surgery in a primary care setting. In a hospital theatre scenario, that's quite usual. They would mark out the lesion, and between the skin marking and starting a procedure is going to be 15 minutes. So the drying time is relevant in that scenario. But in our primary care practice, often we've got less than 5 minutes between putting the pen on the skin and then starting our procedure, or washing the area at least. So that may change the outcomes with less drying time. Now, in their protocols, they tried 3 different cleaning regimes. They did chlorhexidine followed by chlorhexidine. So they did 2 washes with chlorhexidine. They did one which was chlorhexidine followed by betadine, and the final one was betadine followed by betadine. So this 2-step washing, and it's a washing rather than scrubbing is the other important thing. So they weren't scrubbing the marking pens off, they're just running the liquid over the area like they would for a normal surgical clean. They then photographed under the surgical lights, and they made sure they had that level of lighting which is going to emulate what the surgeon would be seeing. The pens chosen were those available in the UK by the local surgeons, and they found the best was a Sharpie W10 black surgical marker. It's an alcohol-based ink with pigments and resins dissolved in the ink. And the next best was a dual tip surgical marker, which was a gentian violet ink. Of all the things, the biro, the standard writing pen, was the one that performed most poorly. They also noted that red permanent markers didn't do as well, especially when using betadine. So that blend of the brown and red color made it harder to see after prepping the area. What they showed was different products have different performance, and it isn't that either gentian violet or permanent markers are better. It's more a matter of which particular agent or which particular pen you use. And they also did notice that the different skin types, different skin colors, have different impact on the visibility of the markings as well. And that problem was highlighted more on a darker colored skin. So there are things to consider, that if your particular pen isn't working well, it might be that the same type of pen, just a different brand, might be more effective at staying on the skin. Now, another study from 2019 compared different surgical marking pens available in Australia, looking at which solution caused the pens to wash off. And they also cultured the pen tips after use. So they found 9 different gentian violet type pens and 3 different permanent markers available. And they measured the reduction in visibility by digital analysis for different washes. So rather than getting the opinion of people in the first study, they actually did a grayscale of the pictures and then did digital subtraction of the pre and post to get a number about how much it favoured the pens. Now, the comparison they used was a brown solution of 1% iodine in alcohol. There's a pink solution, which is a 0.5% chlorhexidine in alcohol, and a red solution, which is a 2% chlorhexidine, so 4 times stronger, also on an alcohol base. And their control was a straight alcohol solution. So each of these is a 70% isoalcohol. Actually try any aqueous solutions. That's one thing to consider, that you can get aqueous chlorhexidine and even aqueous iodine. And the concern is they'll be less effective as a way of cleaning the skin, but they'll also have a different impact in terms of removing pen markings. So something to consider whether you're using a alcohol-based or an aqueous-based solution when you're washing the skin will have an impact as well. Now, I thought this study design was actually quite good, but converting those images to grayscale, they had that very objective comparison. But they also found a better result with permanent markers compared to gentian violet. So the 3 pens which were permanent markers did have much better results overall compared to the 9 gentian violet pens. But there was variation between different brands. The second part of this study was they were looking at cross-contamination risk. And so after drawing on the skin, they swabbed each pen tip to try and culture any skin bacteria. And they didn't grow any positive cultures on any of the pens in this particular study. Now, that does differ to other studies. There are some reports where people have been able to grow bacterial cultures off pen tips. So it's actually quite difficult to know how to interpret this. The study design for each report differs, and some of the reports really felt like they were trying to show a certain result. They're really trying to prove they could get a culture and therefore was a risk for contamination. So we've got to think about how this really relates to real life rather than just a research environment. So when we're marking the skin, we've usually wiped down the skin surface with an alcohol wipe first, just to clean off any dirt and grime. So we're usually drawing on a cleaned surface, and something that's been cleaned with alcohol first. But at the same time, this is not a sterile environment, of course. There's always a normal skin flora, and we're decreasing the flora with our alcohol wipes. We're not sterilizing the skin. It's a clean skin we're working on. We can't sterilize the skin. There's always bacteria around and down hair follicles and things like that. We're just debulking it. So for a person having skin surgery, does a sterile pen make any real difference for infection risk? That's what we've got to consider. That consideration is different to the risk in, say, joint surgery, where even a small bacterial load, or in brain surgery, a small bacterial load can have a really significant consequence to the outcome of the procedure. So myself, look, I now prefer using the permanent markers with a tip that's about 2 millimeters wide. So it leaves a 2 millimeter line on the skin. I tried some of the fine point markers. I found that line was too thin, so it wasn't effective in my surgical marking, while those nibs that are sort of 5 to 10 millimeters in diameter were too thick a line on the skin for drawing out a surgical line. I'm drawing on the skin after using an alco wipe, and I'm drawing on intact skin rather than through an infected wound. So it's a very clean surface. And given all those criteria, and also given the base of the liquid in the pen, it's often an alcohol base in these permanent markers. You can smell those fumes of the xylene and things. I'm not particularly concerned about cross-contamination between patients. I don't think that's a significant risk or a real risk in our scenario of doing skin cancer surgery on effectively clean skin. Now, the final consideration for today's topic is the risk of ink tattoo from the pen. And there have been case reports of this, so it's worth thinking about. So when I'm excising a lesion, my plan is to cut around the outside of my pen markings. So I'm not actually sticking my knife through the pen markings, I'm cutting outside of them. And that way I know that I've taken my planned surgical margin. This particularly applies for ellipses where I can cut around the outside of all the markings quite easily, and therefore avoid that risk of tattooing or staining of the skin from the actual ink. So I'm actually removing all of the ink with my specimen. So for an elliptical closure, that's fine, but there are times when you're drawing up some flap designs where there may be occasions where you have to cut across the marking pen line. So be cautious, or at least conscious, of that potential for pushing ink into the wound and leaving a permanent tattoo stain on the skin. There were certainly some good pictures in one article about someone had a blepharoplasty, and you can see a lovely blue line across the eyelid, which was not the outcome the patient wanted, of course. So this does seem to be a fairly uncommon event, though. I don't recall seeing any scars in my post-surgical practice when I've been following up patients where I've seen tattoo marks. So I'm seeing them on a regular basis, doing their skin checks after surgery and for many years after surgery, and it's not something I've actually noticed, but something to be aware of anyway. But that's all for today. I hope you found this episode helpful and perhaps even picked up something practical to use in your clinical work. A big shout out to HealthCert for all the help with production and distribution of this episode. Lots of good things from them in the skin cancer education space, including helping get this podcast to you. Thank you for listening, and I'll see you next time on Life by 1,000 Cuts.